It was earlier today, the White House released a new report detailing ways the Trump administration is looking to improve the health of children across the country. The report is part of the White House's new Make America Healthy Again Commission, led by Secretary of Health and Human Services, Robert F. Kennedy Jr. And joining me now is Dr. Martin Makary. He is live for us at the White House. He's the Commissioner of the Food and Drug Administration. Doctor, thank you for joining us. Today's report described the current generation as the, quote, sickest in American history. What do you think accounts for that increase in health problems that we are seeing across America's youth?
Well, good to be with you, Andrew. We have to look at every potential root cause. You know, our entire healthcare system has been reactionary. As a physician for more than 20 years at Johns Hopkins, we were playing whack-a-mole. And look, we have amazing new therapies in cancer care, sophisticated operations, gene therapy, proton beam therapy. But when it comes to the health of the population, American healthcare has been a 50-year failure. So we've got to start being proactive and not reactionary. And that means asking big questions we've never asked before. We saw today an announcement of SNAP waivers so that sugary drinks and junk food is removed from SNAP tax dollar programs. Maybe we need to treat more diabetes with school lunch programs instead of just treating kids with Ozempic. And maybe we need to treat more back pain with ice and physical therapy than just surgery and opioids. We need a fresh new approach. We've got to talk about the microbiome and food as medicine. And that means we also have to talk about environmental exposures and cancers and toxins that cause cancer, not just the chemotherapy to treat it. And so that is all a part of this Make America Healthy Again initiative that the White House has put out today.
And there were a couple things that were not mentioned that we know have major negative impacts on children's health. I'm talking about things like alcohol, tobacco, guns, which I believe is the #1 killer of children and teens. What are we to take away from the fact that those were not addressed in this report?
I would take away nothing, because there are hundreds, literally hundreds of health issues in the United States. And those are important issues, the issues that you mentioned. This Make America Healthy Again report focused on some of the giant blind spots in American medicine. You know, as a cancer surgeon, never once did we talk about the root causes of cancer. Never once did we talk about the big question of why are childhood cancers going up? These are cancers of the GI tract, as other cancers in medicine are going down. Well, it's probably because of the interface of the digestive system with what kids consume. And it's not any one single ingredient. It's maybe the cumulative burden of all of these chemicals that don't appear in nature that are going down the GI tract of our nation's kids. It's probably causing some inflammatory reaction. It may be causing an acute immune response. When you have 1 in 4 teenage boys now on attention deficit disorder medication, 1 in 4 teenage girls on antidepressive treatments, we've got to stop and ask, what are we doing? And that's what this report calls for today.
Some of the other criticism has revolved around the use of data. Specifically, you talked about autism, the criticism being that highlighting safety concerns about approved medications and vaccines without sufficient evidence is dangerous in terms of people maybe not going to get their kids vaccinated. Is there any worry that this could lead to any further harm, that some of the conclusions that you guys have drawn together without specific data to point to?
No, Andrew, and by the way, there are hundreds of references that are a part of this report. The only thing that's dangerous is to continue down the path that we're on. Half of our nation's kids are sick. They've got diabetes, pre-diabetes, obesity, or a chronic condition. 40% of our nation's kids now have a chronic disease. And so the only thing that's dangerous is to keep going down the path that we're on. We're taking a fresh new look, and we are taking a whole new approach at health, and that is going to be implemented at all of our health agencies. That means the NIH is going to look more at root causes, not just on chemotherapy to treat late-stage cancers. The FDA is going to look at the food supply. People forget that the F in FDA stands for food. And the Center for Medicare and Medicaid Services is going to look at how they reimburse for health, not just for sickness.
And I do want to ask you about one other topic, and that is that new FDA guidance on COVID vaccines, essentially that it will continue for older Americans and those with one health condition. But won't it potentially put at risk Americans who work in hospitals around patients, or those who live with people who are immune compromised, family members in their own homes?
No, and we've outlined the COVID booster vaccination strategy in a New England Journal of Medicine article this week, myself and Dr. Vinay Prasad. And it puts out a very reasonable framework that puts us more in line with countries in Europe, for example. In the UK, they only recommend the COVID booster at this point if you're 75 years and older or have a risk factor. In France, you have to be over age 80. And so our job at the FDA is to review data that's presented to us about a new drug and then determine if that drug is safe and effective. That's our job. That's our commission. I don't think anyone is suggesting that we should just rubber stamp brand new COVID boosters each year without any clinical data for young, healthy children in perpetuity, such that a new baby girl born today will need 80 COVID shots in her average lifespan of 80 years in the future. We have got to be based on both gold standard science and common sense.
All right, Dr. Martin Makary, Commissioner of the Food and Drug Administration. Doctor, thank you for coming on and responding to some of that.
Thanks, Andrew.